everybody, and welcome to the Healthtech Pigeon podcast, bringing you the top health tech news stories and analysis every week. I'm Belle, and with me today we've got special guest Robbie Huddleston, UK Medical Director at Sword Health, as well as SomX's very own Holly Ruder, and as ever we've got Adama producing in the background. Robert, Holly, it's been a bit of a crazy week, and 2 weeks I'd say for health news in the UK. How are you both faring? Any particular highlights?
Well, yeah, where to begin? First of all, thank you very much for having me on. I've actually been a fan of the podcast for a while, so it feels particularly exciting to be sat here. Where to begin with what's been going on? You sent across a few stories that we might cover, and I really didn't know where to start. But I think coming at it from the perspective of a digital health founder and now employee in a digital health startup, I think it's on the whole quite exciting news. I think things are taking a positive direction. A long way to go before we see how it materializes, but I think on the whole very exciting.
Nice. Holly, what about you?
Yeah, I would say it has been definitely a busy couple of weeks. Lots of change on the horizon. But, we've had first day of spring this week. The sun is shining. So looking forward to, diving into it all.
Yeah, it's a funny one, isn't it? Like this period of change, and everyone asks for change and then change happens and we all get a bit scared as to what that means. And that is the cyclical nature of things. So we can just hope for the best. And as today's stories will attest, there's lots of interesting things going on and we're in good hands in lots of spaces as well. So let's talk about this week's stories. All right. First up, a story from, of all places, Times Higher Education, a place I've only ever been to for university rankings in the past. The NHS Innovation Centre floated as UKRI backs Labour's missions. So this story, UKRI is considering creating a new NHS catapult to drive healthcare innovation and ensure it meets government objectives. As part of UKRI's £9 billion annual research budget, the programme would aim to tackle some of the biggest challenges in UK healthcare, including NHS efficiencies like staffing shortages and digitalisation, as well as other things such as productivity. With improved NHS delivery and reduced wastage in Labour's sites, evidenced by last week's NHSE shake-up, amongst other things, the government is very keen to show that its research budget is being spent wisely. However, will this lead to politicians meddling in research and even more bureaucracy? Or is this a much-needed alignment to ensure that healthcare innovation stays at the top of the national agenda? Robbie, I'll go over to you first. What are your thoughts on this story?
When I heard this news, I actually took it really positively. Obviously, we had the kind of bombshell drop of the disbanding of NHS England the other week. And then we had the Prime Minister talk about how he wants to get behind digital health technology being introduced into the NHS. But I think until you see some action, that they can be fairly empty promises. So this is, a really, I think, positive first step to show that the government is willing to put money where their mouth is. And I think, people have raised alarm bells potentially around this, and I understand that. But ultimately, this is diverting money into innovation in the NHS, or it promises to anyway. And I think there are likely to be quite a few success stories come out of it. I do think we need to be aware of the concerns around the politicization of research and what that could entail. But we have regulatory structures in place for a reason. I think this can all be worked out to ensure that the money goes to the right places and for the right reasons. So I think, I'm giving thumbs up to the government on this one, and I'm excited to see where it goes.
Holly, what about you?
Yeah, I think it's an interesting one, isn't it? Especially as Robbie said, off the back of our NHS England news last week. I think for me, particular in terms of it's coming, ahead of the spring budget, I think, it's to quite phrase this, an interesting kind of action plan. But for me, I think it's really going to see, how is it going to play out in practice? Where is this money going to go? And I think, come the time of the spring budget, it'll be interesting to see, how this is put into action.
Yeah, I think one of the things that strikes me the most about this, and like you say, Robbie, it feels really positive, is that in the UK, we have a track record of really great innovation, especially within the NHS. We've got the NHS Innovation Accelerator. We've got startups that have proven that they can come through and show that evidence and impact and ultimately get to a position where they can help people's lives. So we're coming off a real strength here, I feel, in terms of our research and innovation delivery, which feels really exciting. And yeah, like you say, we've got the spring budget coming up. We've had this NHS England thing. People are asking for change. We need change. And actually, this framework is not that different to things we've got currently going on. Like, Innovate UK is a government body as well, and that funds much of our research and innovation in the UK. So there's also evidence to look at and say, look, it won't lead to political meddling as such. It's just another vehicle within which you can access this funding and hopefully some support as well to help you kind of get along the way. Robbie, I'm interested from your point of view, as the founder of a startup, as someone working in a startup now, what is your view as someone in the weeds of this? You are that innovator leading it. Like, how do you think this could have supported you in your early stages? How do you think it could support other startups now?
It's a really good question. And I can see how this sort of funding would have made a real difference to us early on, because what holds early stage startups back from actually getting a foothold in the NHS and the market there is funding being available. Trusts want to see evidence for clinical effectiveness, for economic considerations as well, and that's totally fair. But where do you start if you're not getting money to run a pilot and generate that evidence? Then it becomes an almost impossible first step to take, and you really rely on the occasional clinical champion, powerful senior clinician in a hospital to get behind you and to push your ideas through. So I think, we don't know exactly how this money is going to be spent, but opening up test beds for early stage startups to validate their products, to get some momentum behind them, I think that could change everything. And certainly for us, going back to our early days at Surgery Hero, we had so many people who wanted to work with us, and they were scraping the barrel for some leftover R&D budget, or we'd come to the end of the financial year and there'd be a little bit of money that they could use to pay for a small pilot. But that's not a sustainable practice, to be going after hospitals and NHS organisations and not asking them, where can you find the money for this? Have you checked here? Have you checked under this pillow, under this cushion? It made things really difficult. And I think if this kind of funding had been around, specifically ring-fenced for innovation, to facilitate hospitals and taking a chance being an early adopter, then I think it could have really changed the game for us. And I would like to see some of that funding being introduced into the NHS in those kinds of settings going forward.
Yeah, definitely. And as well, it's the administrative burden on the people in the startups. And we see this in the academic space as well. People spend so much time applying for these tiny pots of money when they could be using that actually, strategizing and building a company, like building out those pilots, building out those clinical trials, whatever stage you're at. So anything we can do, much like lots of, and we'll talk about this a little bit later, lots of AI and health tech innovation is there to reduce the administrative burden on healthcare professionals. But also we need to think about the founders and people that have got this, burden of, like you say, scraping the barrel for all these little bits of money that they can use to further them. So yeah, I think any sort of cohesive effort to forward that can only be a good thing. That being said, this has been mentioned in the board minutes of a meeting. Who knows if and when it will come to fruition, I think is the question. Anything else from you, Robbie?
I guess, putting on a slightly more pessimistic hat, what I might be concerned about is that this funding ends up going to the chosen few. From my understanding, the Prime Minister's ambition is to really broaden access for innovators, and that should apply to all stages of company, right from minimum valuable PowerPoint to scale ups and companies that are growing rapidly. Everyone should have the opportunity to access this funding if appropriate. And I think we do need to be careful. I don't want to bring up open up old wounds, but we saw what happened with the pandemic, where there were the chosen few suppliers who did really, really well out of it, and a lot of other companies and organizations fell by the wayside because some companies were picked out. So we need to make sure that doesn't happen, and especially this being public money. There's going to be a lot of focus on it, so I hope it doesn't happen. But this should be an opportunity for all innovators if they meet the criteria, and not just for as I say, the chosen few.
Yeah, I totally agree. And I think as well, or rather I hope, that off the back of sort of the COVID scandal and all of that stuff, that there is going to be much more specificity about declaring vested interests and things like that, because I'm not sure people will put up with it again. Maybe we will. I think we have a high threshold in this country of putting up with things maybe other people wouldn't. But I do think declaring those interests early on, if we're seeing lobbying for particular companies, for particular people, being like, actually, why might that be? And I think journalists as well in particular will be sort of really digging into those stories to be like, is there more to this, or is it just a good technology that someone's got behind? I hope we see more of that. I'm sure we will. I know at the moment, lots of people are doing lots of journalism around kind of the COVID anniversary and things like that. It's very fresh in people's minds. So anything like this is going to bring those things to the fore again. And it was so awful in a time where we really were seeing a huge need. We were seeing huge innovation, and we were making all these, we were just putting lots of our own life to the side in order for the greater good, and then to sort of see people do things for their own personal profit doesn't feel good for anyone. So political things aside, I think we can all agree that we don't want politics meddling in this, but any government-backed thing does have the opportunity to be really good and really impactful, especially if we are kind of pushing forward that NHS-based innovation. Amazing. All right. Well, let us move on to the second story. It's a bit of a longer one, so hopefully more discussion here. Our second story comes from AP News, so a bit more of an Australian, a bit more of an American one this time. As AI nurses reshape hospital care, human nurses are pushing back. So the story focuses on the rise of AI nurses, that is, virtual assistants trained to put patients at ease and available to chat 24/7 in multiple languages. They aim to reduce the workload of nurses and healthcare professionals and address issues of burnout and understaffing. So far, so good. But nursing unions are arguing that this, quote, poorly understood technology is overriding nurses' expertise and degrading the quality of care patients received, and is designed to automate, de-skill, and replace caregivers, which is a pretty punchy statement. Their areas of concern include an uptick in false alarms and dangerous advice administered through AI things in hospitals, which they say, instead of minimizing the workloads of nurses, as they claim to do, have the additional effect of meaning that nurses are having to find themselves dealing with more false emergency alarms and erroneous claims, which are distracting at best and dangerous at worst. So it begs the question, really, of ensuring that AI is being used for the good of the patient. And there's no doubt that AI has a place in the future of healthcare. We know that. There's such brilliant innovation happening. But I think what this story really brings to the fore is it needs to work with healthcare professionals and nurses, not against them, not least from an efficiency and innovation standpoint, but really to ensure we're seeing that buy-in from clinicians so that they feel that their jobs are safe and that their skills are staying well regarded and, as they say, not being de-skilled for the use of these virtual technologies. I think there's lots of different directions we could go on this, but Robbie, I know you picked this story to talk about today, so I'll hand over to you first. And what are your thoughts, challenges, concerns here?
Yeah, I've got so many thoughts on this article, and that's why I chose. I have to start off by saying I think that the title is intended to alarm and draw eyeballs. And the first thing I would say about this is we're talking about nursing as if nursing is one career and one role. There's so many different types of nurses. You could be a research nurse where you're based almost entirely in an office. You could be a nurse on the emergency shop floor. They're two entirely different roles. And to talk about how AI is starting to replace, or there's a fear of it replacing nurses. Well, what do you mean by that? So I think first of all I would call that out, that we need to be more specific when we make claims like this. But I think it's an entirely legitimate concern, and definitely one that I've encountered at Surgery Hero and now Sword as well. And Sword being an AI leveraged company, but that's the key here. I think we're using AI to leverage human beings, not to replace them, and it should be seen as an augmentation. I think there's so much good can be done to take away some of that, like you said, administrative burden or the low value tasks that we all, doctors, nurses, everyone has done in hospital. If you've ever worked as a junior doctor and followed consultants around and had a list of tasks at the end of the ward round, that there's a lot of clinical work that really isn't clinical, and they're the kind of things that AI can replace, and I think make the jobs of doctors and nurses so much more rewarding. So I think there's loads to be gained, but at the same time, I think we need to be open to the idea that our jobs are also changing a bit. The AI revolution is upon us, and we can probably expect that the job of being a doctor or nurse in hospital is never going to be exactly the same again. And I'm not sure it's energy well spent if we're trying to resist that. It's happening. So I think it would be helpful for all of us to start to now think about, okay, well, how can we start to work with AI? Consider it as more of a colleague. What's the best working relationship that we can have? It's not going away, but I'm sure that there's something better we could be doing. I think I actually heard it on your podcast that in France, they're now mandating AI education for first-year medical students. I think I heard that on your podcast last week, which I think is great. We need to start taking that approach and tackling this early. And ultimately, I think we also need to recognize that we're in the very early stages, and technological advancements are iterative. So we're not there yet. But ultimately, I think this is going to be better for patients. It's going to be better for clinicians. And it's going to save a lot of money and hopefully make us a much more productive workforce as well.
Yeah, I couldn't agree more. And there's so many things there. But I think at the end of the day, it's not just a UK problem. It's not just a US problem. The fact that clinical staff, including nurses, are massively overworked and overburdened. We don't have enough of them for the work that we have. So technology will have to play a role. It has to. And we're already seeing so many great examples of that where it is helpful. And I do think it's that education piece at the beginning that is so, so vital. I think with the new incoming generation of doctors and nurses and clinicians, that will be less of an issue because they're more, quote unquote, technically literate in the first place. They've come of age in this generation where technology is changing all the time, and they're more openness maybe to that. And they know that that's going to be part of their journey, and they see it as a tool, as something which they just use to, like you say, go alongside their day-to-day life rather than that replacement. But I do think with existing staff, as with bringing new technology into any business, healthcare or not, you have to make sure that there's that buy-in so that they know that this new technology is there to make their life easier. And yes, there will be a bit of a learning curve, but ultimately we think that the input in is less than the kind of output, what we're going to see as a result of that. So I do think it is educating the professionals as to how we can best use this and work with them. But yeah, it's also just bringing it as early as possible, and also developing these tools in tandem with those professionals that it's going to help, really working out what the challenges they are envisaging in the future, the challenges they're dealing with now, what programs they're using that they don't see changing anytime soon. So what do these technologies need to work with versus what could they replace? And I think especially in healthcare systems where you're often using archaic equipment and services and computer systems, it can actually be a bit jarring saying we're going to bring in this AI tool, because you're like, but we're still using a fax machine. And I know we always say that as a bit of a joke because it's the classic NHS fax machine thing. But it can seem a bit jarring when you're bringing in AI thing and you're like, well, actually, can we just upgrade all our computers before we bring in the AI? I can see a little bit of that. You can understand the hesitancy, but I think you're absolutely right. It is an adjunct to the job going forward. Your job is not going to be the same. And I don't know, we went to school in an era where we were told that most of the people in this room will have jobs that don't exist yet. We've always known that's been the case, such as the progression of the modern world, and healthcare and technology in particular is such a brilliant example of that. And that's exciting. It's amazing. Like, we're at a position historically on the world stage where advances are coming thick and fast, and we'll look back at this period as one of huge growth in terms of education and upskilling and technology, and that's great. But getting everyone on the same page is not easy, and of course not.
Yeah, I also think what sometimes happens is we have very different messages coming from different stakeholders with very different objectives. Digital health companies that use AI are, for the most part, pitching to venture capitalists who want to hear about unlimited scale, huge cost savings. So you have some companies come out and talking about, what they're presenting as the panacea of healthcare. Humans can be completely removed from the loop, and investors are going to buy into that because they see the dollar signs at the end of the road. But in practice, I don't think anyone is talking about trying to completely remove roles from the healthcare ecosystem. And so you have some people telling very different messages to different people, and that is definitely leading to confusion. And yeah, it's I think in that article you said there have been a number of protests now from the nurses union in America, and that's understandable. If you feel your job is at risk, you are going to stage a protest. But I don't think it's realistic anytime soon, at least.
Yeah. Holly, what are your thoughts on this story?
Yeah, it's definitely an interesting one. I think I echo kind of what both of you have said, but when I read this, certainly had lots of thoughts. I think firstly, obviously, as you both rightly said, AI is coming, and there's definitely, we need to prepare for that. It's going to change kind of how we think about, healthcare and healthcare delivery in the future. But for me, with this one in particular, it sort of feels a little bit like, not the implementation kind of gone wrong, but at SomX we talk a lot about, and obviously on the podcast as well, about this idea of, AI and clinicians, not, AI replacing clinicians. And for me, I know this article has sort of painted this implementation in a slightly negative light. And I think kind of rightly so, it's clearly caused a lot of frustrations. But for me, it sort of sparks questions around kind of, they're clearly trying to implement this AI as a way of supporting nurses, creating efficiencies, alleviating burden. But actually, in the way they've done that, it's caused a lot of kind of, negative consequences. Like, it's been met kind of with rebuttal. And ultimately, if we are going to get to a place where AI is supporting healthcare professionals and, really improving those efficiencies, and that's ultimately what we want to get to, we need to be going about this kind of implementation adoption in the right way. So I think, for me, that's kind of the first thing with the nurses. And as you said, Belle, about making sure that these tools are really being developed alongside these healthcare professionals, so ultimately they have kind of the best chance of impact. For me, I think on the other side is the patient piece as well. where they've talked a lot about kind of, patients being met with this AI nurse potentially at the bedside and doing scans. And I think maybe the first question kind of comes to trust. I know particularly with kind of the younger generation, we're more kind of, adept to it. We're kind of, used to this technology, but particularly for the older generation, it's new to them. Like, it's not something that, has been the norm for many, many years. And I sort of wonder kind of what the impact that has on kind of their perception of healthcare delivery as a whole. And I'm not sure if you guys had any kind of additional thoughts on that, but I guess the final piece there is as well, healthcare professional trained for years to become doctors and nurses. And I think it is that kind of specialist education and training piece where, they'll see, I think they actually mention it in the article, where they're seeing a patient and actually they pick up on, an extra condition based on other kind of vital signs. And it's like, well, could actually AI do that as well? Could it be the case that potentially we're missing, really vital signs that human nurses have that ability? So yeah, lots of various different thoughts there. But Belle, Robbie, I'm not sure if you had anything you wanted to add to that.
Yeah, you made two really good points there. I think one around the patient experience and one around the nursing experience. To start with the patients, you're right. Not everyone wants this, and I'm very strongly of the belief that we shouldn't be forcing digital healthcare onto anyone. In my eyes, this is all about giving options. As you say, increasingly the younger generation want to get their care at home. Not just the younger generation, but increasingly a lot of people want to be able to access care at home. They don't want to have to take time off work, travel to hospital. But at the same time, there are many people who really value that face-to-face experience with a human being in the clinic, where they're sat opposite a doctor or nurse taking notes. I totally get that, and I think what innovations such as AI nursing, I can look at it from the sort of perspective from physiotherapy. What that allows is for the reallocation of resources. Those people who are happy with care at home, who want care at home, can get it. But it means that the in-hospital clinicians are then freed up to deal with those individuals who either need the face-to-face care through clinical need, or who want it because that's how they want to experience their healthcare. So right now we've got the longest ever waiting list. I think there 70% of physiotherapy appointments aren't achieved within the 4-week target, or they wait longer than 4 weeks. So we need to do something to take some of the burden off the hospital clinicians anyway. And I think this is a really neat way of doing that. So yeah, totally agree. We need to protect face-to-face care for those who want that, but also be mindful of the fact that we can't give it to everyone, and two, there are plenty of people who prefer the alternative, which is at-home AI leveraged healthcare. That's from the patient perspective, and then going back to the nursing perspective, I have total sympathy for those who feel that their jobs are being taken and they're campaigning for it. But I also think, coming back to the kind of education piece, we now need to be wary or mindful of the fact that when we're going into clinical careers, that a certain direction is going to take you a certain way. And if you choose to go down, I'm going to use radiology as an example. We know that radiology is being increasingly leveraged by AI. If you choose to go down that career path, then you need to be comfortable with the fact that you're probably going to be working with an AI colleague in some way, shape, or form. And yeah, I guess very difficult if you've been in that career for a while and now it's suddenly changing. But I think we can now start educating people at the beginning of the process. This is the career path you're taking, but you need to be aware of the fact that likely you're going to be working with an AI colleague down the line. And I have seen examples of people going out of I'll take physiotherapy as an example again. I've seen examples of people leaving face-to-face practice to join a digital provider, and then not really being happy with the work experience that they have. And that's fine, but no one's forcing them to go down any track. And I think it's more about helping people to understand what each track means at the early stage. So totally, I sympathize absolutely with people whose jobs are now changing. But I think as a collective, we need to now start being mindful of the fact that people need to understand what that means down the line. And I'm somebody who went into the emergency medicine training prior to any AI stuff, and I realized I'd made the wrong choice. So I think career education is going to become increasingly important when we start to factor in these different components.
Yeah, and I think that holds in any industry, doesn't it? You wouldn't, a career is, 50 years long sometimes. There is a long stretch of time, and no one goes into it expecting it to be the same by the time they end. And tools upgrade, technologies get better. I'm sure plumbers are using new technologies if they can. From a communication point of view, things have changed massively. Think of kind of traditional PR 10 years ago, and now you've got more social media. I mean, social media has risen. You don't expect things to stay the same. So I think there has to be sort of, that appetite to always being open to those new things. And I think it's maybe something which has been neglected a bit, because you sort of assume that openness with someone who is in a clinical profession, because they are a scientist by background. They want to help people. They are at the cutting edge of what can be done to improve patient care. So maybe that neglect has happened because it's just sort of that assumed buy-in, of course you'll use what we give you because it's the best. But actually it sort of forgets the fact that actually these people are also very evidence-based, and they want to see that there is evidence, there is impact data. We know it's going to make a difference before we commit to using this. We are short on time, so we don't want to train for something which is going to be upgraded to the next iteration in a year's time. So it's all these other elements that actually become ever more important, which is that in the grand scheme of not just you as a clinician, but a clinical team in a hospital, how do these things integrate in a way that feels robust and important enough for people to invest their time, even when they do want the best. We know that. So maybe that neglect has happened a little bit, because we're just we'll give them the best tools, they'll use them. And you're well, they don't actually have time to train on that. Is it going to make a difference?
Yeah, and I think that's actually very fair. Probably a consideration that gets overlooked is that it's not just about your job changing. It actually can be quite disruptive, especially in the early stages. And one of the other articles you shared was about interoperability. And I think step two that McKinsey pointed out, that it's not just about funding the innovation. We need to really think about implementation, and that. So, and it does have an impact on people's lives, and people are going to have to probably spend more time than they've been used to, while the technology becomes embedded. So I think that's totally fair, and probably not something we give enough credit to frontline staff. Is that they're already scrambling, working at 99% capacity a lot of the time, and if we're going to throw in another tool that they've got to become familiar with, then there's going to be knock-on effects for sure.
I actually thought there was quite a nice piece in this article. I know, as we said, it was largely negative from the nursing union, but there was a nice little example about how they use it for sleep apnea patients. Actually, let me find who said this in the article before I quote them. Dr. Joseph Stanford, the Center Health IT at the University of Arkansas Medical Sciences. I nearly said Arkansas, but any Americans, block your ears. He said that there's a problem at his centre treating sleep apnea because many patients only answer their phones in the evening, usually between dinner and their children's bedtime, which is when he doesn't have that many staff on call. So, quote, what we need to do is find a way to call several hundred people in a 120-minute window. I don't want to pay my staff overtime to do so. Now, that obviously gives you the financial motivation behind this. Calling people out of hours does cost more money because you have to pay for people to come in outside of their regular hours. But also, this is a positive as well for nurses that don't want to be called in to work overtime on their day-to-day shifts. And this isn't an exception. this is how patients are asking to be communicated to. They want that communication in this time slot daily, it seems. So this is not something you can be like, oh, we'll just pay overtime this week and we'll sort it out next week. This is something which needs to be part of the process. Now, if nurses are unwilling and or unable to do that overtime, if hospitals are unwilling and or unable to pay for that overtime, then technology-led solutions such as these AI nurses are brilliant, and they serve every person's motivations within that. They help the patient, they get the patient a call when they want them, they get the nurse to not have to stay on late, and they get the hospital to not have to pay extra. So even though it is hidden within that article, which was overall quite negative, I thought that was actually a really positive use case of how this technology can really help these specific use cases.
Totally agree. And there are so many examples just like that. I'm sure nearly everyone listening has an experience of sitting on the phone to the GP surgery waiting for the person on the other end to be able to pick up because they've got several hundred people calling at one time. And this would eliminate those types of frustrations that we all feel potentially overnight. So, yeah, I think ultimately keeping an open mind is going to be key for everyone, patients, clinicians alike. But we do need to recognize the impact that it's going to have on the staff who need to embed these technologies and be sympathetic, but also supportive, actually put money behind how we implement these technologies and not just expect it to happen within the usual workflow of that organization.
And I tell you what, this is interesting to link back to the first story, because you've just mentioned money and it's made something ding in my head. But actually, these projects that are helping companies innovate and embed into the NHS are not just helpful from a company standpoint to generate that clinical evidence, that clinical impact. It also allows hospitals and healthcare professionals to get familiar with this technology as well and see if it actually does make a difference, which is kind of nice.
Totally. And actually, if we take the US model, a lot of technologies and innovations spill out from universities and their associated hospitals that work with them, and that means that there's skin in the game. When you get people involved in developing the technology, whether that is reputational or actual financial or otherwise skin in the game, people are going to get behind it. And I'm sure we've all felt it. I've certainly felt it in hospital when you're being asked to implement something and you've had absolutely no say. You've had no input. This has happened overnight, and now you're expected to use this new tool. Whereas, as you say, things like the NHS Catapult or Innovation Catapult is an opportunity to get frontline staff involved in the early stage to influence what it is that they're actually going to be implementing. And as I said, they'll have skin in the game going forward, and there'll be more motivation to hopefully make it work.
Mm-hmm. Definitely. Cool. All right. Well, I think that's a nice point to finish talking about that story on. But lots of good conversation, and I think in general we're all open-minded and aware of all the issues with this. And that's the thread really that joins our stories week on week, is that we have this great innovation, but how does it work in the actual larger ecosystem that is embedding and actually actioning these technologies so that patients see and feel the benefit of them? All right, and on to our final story. Can AI help detect cognitive impairment? So this story comes from Healthtech World this week. Researchers have built a simple, affordable gadget to detect mild cognitive impairment by tracking how well older adults walk and stand while counting backwards at the same time. It feels like something you'd probably do as a test to see if you're drink driving. Powered by AI, the system correctly identified 83 cases of MCI. The goal is to get this device into senior centres and clinics so more people can catch cognitive issues early on. Robbie, I know you've read this story. What are your thoughts and feelings here?
Yeah, I think this is a really nice example of AI for good. This is essentially talking about looking at how someone is moving around, walking, and coming up with a potential diagnosis off a few seconds or minutes of data. And this is stuff that the human eye can't detect. Early cognitive impairment goes undetected for years most of the time. I think there was a stat in that article where only 10% of people with early cognitive impairment or something like that actually get diagnosed.
8%.
8%. Wow. So yeah, clearly this is something we can improve on. Clearly we have missed so many diagnoses in the past because it's very difficult to pick up. So I think this is a really beautiful use case, so simple, but with potential to do an awful lot of good. That there are medications that need to be started during the mild cognitive impairment phase to delay progression to dementia or severe cognitive impairment. But not only that, there are potentially going to be new medications found down the line where they're only effective at this stage. So having a really neat way of screening individuals for MCI, I think can only be a good thing down the line. And it can also influence other forms of healthcare. For example, I'm very used to thinking and talking about surgery. Post-operative delirium is a big issue, and it causes a lot of harm to both the individual undergoing surgery and their families, and it's very expensive for healthcare organizations. And we know that you're more likely to have post-operative delirium if you have mild cognitive impairment. We also know that there are steps can be put in place to minimize the risk. So in terms of anesthetic techniques, having an individual in a side room with their belongings around them, all these things that kind of reduce the risk of what is a devastating complication of surgery. Again, if we're able to pick this up and diagnose more people with MCI, then we can avoid those sorts of issues. So I think this is a great story. I'd like to see it in action. And what was pretty cool about it actually as well, they said, we're using gait tracking to detect MCI, but there are many other conditions that can be picked up from this sort of technology. So I'm excited to see where this one goes.
It's really cool. I love that it's portable as well, because a hospital could just have one and it can be shared between different departments if needed. They've obviously mentioned it going into senior care homes and things like that. Obviously, we don't know the price point of this yet. It's very early stages, but at the point that it is, you could think that, even care homes could use it as a device for people that are residents, are not residents as well, to sort of continue that expanded community care, which is really interesting. But yeah, love the story. Holly, you're obviously coming from a neuroscience angle. Is there anything here that you think is particularly interesting?
Yeah, I mean, so totally agree with what you both said. I think it's nicer to end on kind of a positive implementation story. But yeah, I mean, 8% of people in the US with MCI receive a clinical diagnosis. That is a staggering statistic. And I think, Robbie, you're totally right, with thinking about kind of applications to other neurological disorders. We know that this early onset phase, often symptoms for various neurological conditions go kind of undetected for years before people receive a clinical diagnosis. So to see a solution like this that, is, as you said, Belle, is portable, it's a scalable solution, I think, yeah, definitely a very positive step forward. That was not a pun, by the way.
Step backwards, please. I think is what I had to do. No, it's really, really great. And I think, Robbie, to your point as well, like there's so much development in the drug discovery space in this area as well. But you can't treat something that you haven't diagnosed. And it's that clinical diagnosis number that needs to come up before we see the benefits of the medications as well. Because it's all well and good having a medication for this, but if only 8% of people with it are able to access, then really what's the good of that? So a really, really exciting thing. And like you said, a lovely feel-good story to end on. We love to see health tech innovations in the wild, doing cool things, and especially ones with lots and lots of potential future applications, which I think this is. So I think we can wrap up there today. Thank you so much for coming, Robbie, Holly. Lovely to have your chat and conversation on a Friday morning. As ever, if anyone wants to read the full stories or read the rest of this week's stories, please go over to Healthtech Pigeon, the newsletter. Or if you're more of a biotech person, we have Biotech Dodo as well for the week's biotech news. Thanks again. Have a wonderful weekend, everyone, and we'll see you soon. Bye.
Thank you very much for having me.